Yeah, dexamethasone is a form of steroid. It's a very powerful steroid. And what it will do inside the body is help to prevent the inflammation that takes place, that trails the virus illnesses. And if you could control some of the inflammation, you can kind of quell down the level of the impact of the infection, and the person can certainly have some better chance of recovery. And a host of other medications have been tried in various trials over the last 18 months, and very few of them have been able to work. There are some new ones that have been approved, and St. Vincent's hoping to see if they could get a hold of those too. Ivermectin this year, they had used a test tube in Australia and found that ivermectin did inhibit the replication, multiplication of the virus in a test tube. And they're very, very small studies. However, when they have looked at this medication, ivermectin, which is mainly used for parasites, to kill parasites like worms and so forth, in both humans and animals, they have not found that it is effective. However, some people are taking it and are swearing by it, but unfortunately, in most of the world now, most countries have the government does not have any ivermectin in its stores. Pharmacies typically will not have ivermectin either because it's not approved for COVID, so they would be at legal risk to give it to a patient who basically for an indication that is not approved for. Now, we believe that some people are bringing it in on the black market. It is available for worms, and the veterinary industry have higher doses for animals like cattle and horses and so forth. Sometimes because it's not available in the human dose form for an ordinary parasite, some people are using the veterinary version of it, which is sometimes 5 to 10 times the dose that is acceptable for a human being.